I'll start with Dr. Laura Morris. How long is the vaccine good for? How often will we need to get it?
That's a great question, and honestly, I wish we knew the answer completely 100%. We know, based on the studies that have been done so far, that the folks who got the vaccine in the beginning of those trials, that's been at least 6 months for some, and the immunity is still good. If we will need to get the vaccine repeatedly, sort of a booster like a flu shot, is yet to be determined. We know the immunity will last long enough to protect us and get us out of the situation we're in now, and more research will need to be done.
Well, after you've received both vaccinations, do you still have to quarantine if you're exposed to COVID-19?
So right now, the recommendations have not changed. I think that's what we're all looking forward to and what we're all hoping for. But right now, not enough people are vaccinated, and we don't know enough yet about how completely the vaccine prevents asymptomatic transmission to change those guidelines just yet. So folks that would have been exposed will still need to follow public health guidance and quarantine and wear masks and all of those things.
Dr. Haight, Stephen from Jefferson City asks, once I get my shots, what exactly does that mean? Can I be more social with my kids, my grandkids, having them over to the house? When I go to the grocery store, I assume I should still be masked and wear a mask in public.
Yes, even though you've received your vaccine and even after your second vaccine, you need to continue to do the things that the CDC recommends and that we are recommending. Continue to wear your mask when you're out and about. We also want you to physically distance from one another when you're out and about as well. When you go and visit friends and family, make sure that they are healthy, make sure that everyone is taking care of themselves. And again, enjoy each other's company, but you may want to be a little bit further apart than what you may have been a year ago.
Dr. Haight, if you've had COVID and you're still showing antibodies, why are some people recommending you still get the vaccine?
So we recommend that you continue to take care of yourselves, but we also want you to get the vaccine. Again, the studies being done to show immunity once you've had COVID. We're doing those as well as getting the vaccine on top of if you've had the COVID as well. So we are encouraging people, even though you may have had COVID, once you're free of the disease and asymptomatic, to go ahead, get signed up for the vaccine, as we think that will be the most beneficial for you and protect you the most.
Everybody wants to know about the exceptions. Dr. Morris, one person is asking, is the vaccine effective for those with a compromised immune system? Should they get it?
Yes, and in fact, folks with a compromised immune system are at an increased risk for severe COVID and severe disease. So absolutely, those are folks we want to get the vaccine. You know, it's true that depending on the disease or condition a person might have, their immune system might not respond as strongly, but that's still really important protection. And so absolutely, folks with immunocompromising conditions or autoimmune diseases should definitely get the vaccine.
I'll let you both answer the next one because we've given doses in Columbia and in Jefferson City, but there aren't enough for everyone. Several people have submitted questions asking, how is it determined who gets the vaccine? They've submitted their information online on every form they can find, and there are multiple ones, and they believe they're eligible, yet they're not being called.
I can answer this one first. I know that absolutely folks are out there looking for vaccine in every nook and cranny, and at MU Healthcare we have a long list and a short supply. So this is really simply a supply and demand issue, and I encourage those folks to keep their names on those lists and jump at the chance when their opportunity comes up. But the reality is we just need more supply so that we can get those shots in arms.
So at Capital Region,
Dr. Haight?
We are experiencing the same thing. we have a shortage of vaccine available to us, and so we have asked each of our patients to contact their physician, either their primary care physician or their specialist, to be screened to make sure that they qualify for the vaccine. And then we give those names to our schedulers who are making the calls. And so when we find out how much vaccine that we have available on a certain day, we have the schedulers going through that list of people who qualify according to what the state has recommended to receive the vaccine. Again, as Dr. Morris said, we have a very short supply and a much larger number of patients who are needing the vaccine.
Let's put some numbers to it. First, Dr. Haight, tell me how many doses Capital Region gave in the latest vaccination clinic.
So we have been giving vaccinations, and we have a plan for 800 vaccines to be given over the next 2 days at Capital Region. Total, since we have been giving vaccinations for healthcare workers as well as for our patients, we've given between 4,000 and 5,000 doses to patients, and many of those are coming up to their second vaccine at the end of this week on Friday and Saturday.
Dr. Morris, give us a sense of what MU Healthcare is given at that Faroe Field site.
That Faroe Field site is pretty impressive. You know, when folks get up there, they tell us how efficient the process was and how smooth the process was. And in fact, we were able to give over 2,000 doses on each of our last two high throughput clinics, the last Thursday and Saturday, despite the snow. Not a single dose wasted and over 2,000 shots given each day.
And clearly not enough for everyone who wants them. One last question here. I'll send it back to Dr. Morris. How can we be sure that at our second dose, at the appointment, that our second dose will be there for us?
That is a common concern and actually has not been a problem at all. So the federal government is holding the supply in such a way that when your first dose is sent and you get that shot in your arm, it's guaranteed that the second dose will arrive at the same site, the same clinic or location where you got your first shot, and it'll arrive at the right time. So depending on the type of vaccine, either 3 weeks later for Pfizer or 4 weeks later for Moderna, and that has not been an issue. So if you get the first shot, there's a second one coming.